LECOM, the Lake Erie College of Osteopathic Medicine, is the largest and most applied to medical school in the U.S., offering programs for future osteopathic physicians, pharmacists, dentists, and other healthcare professionals. In today's video, we explore 45 LECOM interview questions and answers. Don't forget to customize these answers to highlight your unique qualifications and experiences. Question number 1. Can you tell me about yourself? This is usually the first question in a LECOM interview and sets the tone for the rest of the conversation. The goal is to provide a concise yet personal overview that ties your background, education, and motivation for medicine together. Avoid repeating your resume line by line. Instead, share a story arc that shows your journey toward osteopathic medicine. End with why you're excited about LECOM and how your values align with their mission. I describe myself as someone who's deeply committed to patient-centered care, community service, and the lifelong pursuit of learning. I earned my degree in biology and currently work as a medical assistant in a primary care clinic where I've developed a strong appreciation for preventive medicine and the importance of clear, compassionate communication. Working closely with patients from diverse backgrounds taught me how empathy and education can transform health outcomes. When I shadowed a DO physician, I was inspired by how osteopathic medicine connects structure, function, and lifestyle to promote whole-person wellness. That experience showed me that true healing comes from understanding both the science and humanity of each patient. I've also been active in community health outreach, helping organize screenings and wellness events for underserved populations. What draws me most to LECOM is its commitment to professionalism, affordability, and service-based education, values that perfectly mirror my own philosophy of practicing medicine with integrity, compassion, and a focus on prevention. Question number 2. Why medicine? This question helps interviewers understand your motivation for pursuing medicine and whether it comes from genuine, sustained interest rather than convenience or prestige. Your response should be authentic and focus on meaningful experiences that shaped your desire to serve others. Highlight key turning points, such as patient encounters, volunteer work, or personal observations, and connect them to your long-term goals as a physician. Avoid cliches and instead show emotional insight and reflection. I've wanted to pursue medicine because it perfectly combines science, problem solving, and the opportunity to impact lives in a deeply personal way. Working as a medical assistant exposed me to the human side of healthcare. The long conversations, the fears patients express, and the relief they feel when someone truly listens. Over time, I realized that medicine isn't just about diagnosing, it's about restoring trust and hope. I remember helping a patient who struggled to manage diabetes, and after months of education and support, her progress showed me the power of persistence and empathy in care. That experience confirmed that medicine is more than a profession. It's a calling to advocate for wellness and human dignity. I'm eager to continue this path through medical school, where I can expand my skills, learn new perspectives, and eventually serve as a compassionate, community-focused physician. Question number 3. Why osteopathic medicine? Interviewers ask this to ensure you understand and genuinely value osteopathic philosophy rather than viewing DO programs as a backup option. To answer effectively, show that you've researched the core tenets: mind-body-spirit connection, holistic treatment, and preventive care. Mention any direct exposure to DOS or OMT practices and how those experiences shaped your philosophy of care. My interest in osteopathic medicine began when I shadowed a DO who integrated both scientific knowledge and a holistic understanding of his patients. I was struck by how he spent time discussing lifestyle, emotional stressors, and family dynamics before making any treatment decisions. It showed me that healing involves more than addressing symptoms. It's about understanding the whole person. As I learned more about the body's innate ability to self-regulate and heal, I realized this approach deeply aligns with how I view health and humanity. During my clinical work, I saw how small changes, like improving posture or reducing stress, could have lasting effects. The osteopathic philosophy's emphasis on prevention, empathy, and patient partnership resonates with me on every level. At LECOM, I'm eager to further develop that perspective through hands-on learning and a commitment to compassionate, integrative care. Question number 4. Can you explain why you chose the Lake Erie College of Osteopathic Medicine, LECOM? This question tests your knowledge of the school's mission, teaching style, and culture. Avoid generic responses. Show you've done your research on LECOM's curriculum options, PBL, LDP, DSP, community service initiatives, and values like professionalism and affordability. Explain how LECOM's philosophy fits your learning style and future goals. I'm drawn to LECOM because of its reputation for producing highly disciplined, community-focused physicians who emphasize professionalism and integrity. I appreciate the structured yet flexible curriculum that allows students to choose the learning pathway that best suits their style, particularly the problem-based learning track, which aligns with how I learn through collaboration and active discussion. LECOM's strong focus on preventive medicine and community service reflects the kind of physician I aspire to be, one who not only treats illness but promotes health at the community level. I also value LECOM's emphasis on affordability, which allows students to graduate with less financial burden and focus on service rather than debt. During my research and conversations with current students, I was impressed by the supportive environment and mentorship culture. I see LECOM as the ideal place to strengthen both my medical knowledge and my commitment to compassionate, patient-centered care. Question number 5. What qualities make a great physician? This question allows you to show self-awareness and understanding of what the profession demands. Use specific traits and back them with examples. Don't just list qualities. Highlight values like empathy, integrity, adaptability, teamwork, and lifelong learning, explaining how they translate into real patient interactions and outcomes. I believe a great physician combines empathy, adaptability, and a commitment to lifelong learning. Empathy allows patients to feel heard and understood, which builds trust and improves compliance. Adaptability ensures that physicians can handle uncertainty, whether it's a difficult diagnosis or evolving medical technology, while staying calm and solution-focused. In my clinical work, I've seen how small gestures of compassion, such as explaining conditions in simple language or taking extra time to reassure a worried family member, can make an enormous difference. A great physician also values collaboration, respecting the expertise of nurses, technicians, and other providers to deliver the best care possible. Finally, humility and curiosity drive continual improvement, a reminder that medicine is both art and science. The best physicians never stop learning, reflecting, and striving to do better for their patients and their communities. Question number 6. What is your greatest strength? This question helps interviewers evaluate your self-awareness and how your strengths align with the traits of a successful medical student or future physician. Choose a strength that's genuine, supported by evidence, and relevant to medicine, such as empathy, perseverance, communication, or adaptability. Give a specific example that demonstrates this quality in action, ideally from your clinical or academic background. My greatest strength is my ability to stay calm and focused under pressure while maintaining empathy toward others. Working in a busy outpatient clinic taught me how to juggle multiple patients, urgent calls, and unexpected challenges without losing composure. For example, during flu season, we were short-staffed, and I often had to assist physicians, manage intake, and comfort anxious patients, all at once. I learned to prioritize effectively, communicate clearly, and stay emotionally present for those who needed reassurance. This strength not only improved patient satisfaction but also helped our team work more efficiently. I've realized that medicine requires more than intelligence. It demands patience, emotional steadiness, and compassion, even in chaos. Those moments showed me that being dependable and calm can inspire confidence in patients and coworkers alike, and it's a quality I'm committed to carrying forward as I pursue osteopathic medicine. Question number 7. What is your greatest weakness and how are you improving it? This question assesses your honesty, maturity, and willingness to grow. Choose a real but manageable weakness, not something disqualifying, and show what steps you've taken to improve it. End with a reflection that highlights growth and awareness. My greatest weakness has been my tendency to take on too many responsibilities at once because I genuinely want to help others. Early in my clinical role, I found myself saying yes to every task, charting, assisting with procedures, covering shifts, until I realized I was burning out and losing focus. That experience taught me the importance of setting healthy limits and prioritizing quality over quantity. Over the past year, I've worked on improving this by scheduling tasks, communicating boundaries respectfully, and practicing mindfulness techniques to stay centered. I also remind myself that teamwork means trusting others to share the workload. Learning to delegate has made me more effective and less fatigued, allowing me to show up as the best version of myself for patients and colleagues. I believe this balance will be crucial in medical school and as a future physician, where pacing and sustainability are key to long-term success. Question number 8. Describe your greatest challenge and how you overcame it. Interviewers use this to evaluate your resilience, problem-solving skills, and ability to grow from adversity. Choose a challenge that required emotional strength or adaptability. Explain the situation briefly, what actions you took, and what it taught you about perseverance and self-reflection. My greatest challenge came during my first year working in healthcare, when I struggled to balance patient expectations with time constraints. There was one elderly patient who felt unheard because I couldn't spend as much time with her as she wanted. It bothered me deeply. I never wanted anyone to feel dismissed. I decided to reevaluate my workflow, improve my communication, and make each interaction more intentional, even if brief. By maintaining eye contact, using reassuring body language, and summarizing next steps clearly, patients began to feel genuinely cared for. Over time, I became better at managing both compassion and efficiency. That experience taught me that challenges in medicine aren't just logistical, they're human. It strengthened my emotional intelligence and reminded me that small adjustments in empathy can create big differences in trust and outcomes. Question number 9. Describe a time you failed and what you learned. This question isn't meant to expose flaws. It tests humility and self-improvement. Choose an example where you took responsibility, learned a clear lesson, and applied it successfully later. Focus on growth rather than guilt. I once failed to double-check a medication refill request that contained a dosage error. Thankfully, the pharmacist caught it before it reached the patient, but I felt terrible. That moment forced me to confront my tendency to rush under pressure and reminded me that in healthcare, small details matter immensely. I spoke with my supervisor, took full accountability, and implemented a double verification process for all future refills. I also began keeping a daily checklist to ensure nothing slipped through the cracks. Over time, I became known for my accuracy and organization, turning a mistake into a strength. That experience humbled me and reinforced a lesson that medicine demands both diligence and reflection. I now approach every task, no matter how routine, with complete focus, understanding that patient safety depends on precision and accountability. Question number 10. Tell me about a time you resolved a conflict. This evaluates your interpersonal skills and professionalism. Choose a situation that shows maturity, communication, and teamwork. Explain how you approached the conflict calmly and worked toward a constructive solution that benefited everyone involved. While working in a clinic, I had a disagreement with a colleague about patient flow. She felt I was calling in patients too slowly, while I believed rushing compromised quality care. Instead of letting frustration build, I asked to discuss it privately after clinic hours. We both shared our perspectives, and I realized her concern came from time pressure, not criticism. Together, we developed a new system where I prepared charts earlier while she updated the waiting list, improving efficiency without sacrificing quality. That small compromise increased our mutual respect and improved patient satisfaction. It reminded me that clear communication, empathy, and teamwork often turn tension into collaboration. Conflict is inevitable in healthcare, but how you handle it defines your professionalism. Since then, I've made it a point to approach disagreements with openness rather than defensiveness, focusing on shared goals instead of personal differences. Before we continue, I just want to take a moment to thank you for watching this video. You can download a copy of these interview questions and answers in PDF format by clicking on the link below and supporting my channel by making a minimum donation of $3. Your support allows me to keep creating valuable content to help you pass your interview and land your dream job. Thanks for your support and appreciation. Question number 11. Tell me about a time you made a lasting impact. This question helps measure your initiative, leadership, and commitment to service. Choose a meaningful experience where your contribution had visible results, ideally related to healthcare or community involvement. Focus on outcomes and what you learned about responsibility. One of the most meaningful projects I've been part of was organizing a community health screening event for underserved families. Many lacked access to preventive care, so I helped coordinate volunteers, secure supplies, and create educational materials about nutrition and blood pressure management. On the day of the event, we screened over 200 people and identified several with undiagnosed hypertension and diabetes. Seeing how one day of proactive outreach could potentially prevent long-term complications was eye-opening. Months later, I learned some attendees followed up at clinics we recommended. That impact reinforced my belief that medicine goes beyond clinical walls. It's about empowering communities with knowledge and access. It also deepened my respect for preventive care, a cornerstone of osteopathic philosophy. Knowing that small actions can ripple into long-term health changes is what continues to motivate me toward becoming a physician. Question number 12. What leadership roles have you held and what you learned? This question evaluates your ability to guide, motivate, and take responsibility for others. Emphasize collaboration, accountability, and humility. Discuss how your leadership experience shaped your interpersonal skills and decision-making. During college, I served as president of our pre-medical society, where I managed event planning, mentorship programs, and volunteer initiatives. Initially, I underestimated how challenging it could be to coordinate busy students with different goals. I quickly learned the importance of delegation and communication. By creating smaller committees and encouraging open discussions, we became far more productive and inclusive. One of our most successful efforts was launching a peer tutoring program that supported struggling students and improved overall retention rates. That experience taught me that leadership isn't about control, it's about empowering others to contribute their strengths. It also taught me patience, listening, and adaptability, qualities essential in medicine. As a future physician, I want to lead in a way that uplifts both patients and colleagues, fostering teamwork that improves care for everyone. Question number 13. How do you handle stress and maintain work-life balance? Interviewers ask this to see if you have healthy coping mechanisms for the rigors of medical school and clinical life. Discuss specific methods, time management, exercise, reflection, or support systems that help you maintain resilience and focus. I handle stress by maintaining structure and mindfulness in my daily routine. Medicine is demanding, and I've learned that the key isn't avoiding stress, it's managing it intentionally. I prioritize my tasks at the start of each day, separating urgent needs from long-term goals, which keeps me from feeling overwhelmed. Physical activity is also a big outlet for me. I run and practice yoga several times a week to clear my mind. I also journal to reflect on challenges and lessons, which helps me stay emotionally grounded. During my time in clinical settings, these habits allowed me to remain calm even during high-pressure situations. I also make time for family, friends, and hobbies because connection fuels my motivation. By integrating structure, movement, and reflection, I've built resilience that I know will serve me well through the intensity of medical training. Question number 14. How do you de-stress or maintain wellness? This is similar to the previous question, but focuses on personal well-being. Show that you value self-care and recognize that maintaining balance makes you a better caregiver. Avoid superficial answers. Be genuine and specific. I've learned that maintaining wellness is about consistency, not perfection. My favorite way to de-stress is by combining physical activity with creativity. I often take long hikes and use the quiet time to reflect or sketch scenery. It helps me reset mentally and reconnect with why I chose healthcare in the first place. I also enjoy cooking healthy meals, which reinforces balance between body and mind. During especially stressful weeks, I set small, achievable goals like taking a 10-minute mindfulness break or reading something inspiring before bed. These small acts remind me to slow down and breathe. In my clinical experience, I've seen how burnout affects both patients and providers, so I take wellness seriously, not just as a personal habit but as a professional responsibility. Staying healthy allows me to bring energy, empathy, and focus to every patient interaction. Question number 15. What specialty interests you and why? This question tests your self-awareness and exploration within medicine. You don't need to have a final decision. What matters is thoughtful reasoning. Show exposure to the field, connect it to your values, and emphasize openness to future discovery. I'm particularly drawn to primary care because of its continuity and preventive focus, which align perfectly with osteopathic principles. During my time working in a family practice clinic, I saw how relationships between physicians and patients can span years, allowing for true understanding and proactive health management. I was inspired by how the doctors blended science with genuine care, treating not just diseases but the lives attached to them. I value the challenge of addressing diverse conditions while fostering trust and education. I also appreciate that primary care physicians often serve as community anchors, identifying social factors that influence health outcomes. While I remain open to exploring other fields in medical school, I know I want to practice medicine that prioritizes listening, prevention, and empowerment. I'm excited by the idea of combining osteopathic techniques with patient-centered education to improve long-term wellness, especially in underserved populations. Question number 16. Where do you see yourself in 10 years? Interviewers ask this to evaluate your long-term vision and commitment to medicine. Your answer should show direction, but remain flexible. Focus on growth, community involvement, and alignment with LECOM's values of service and professionalism. Avoid sounding overly specific about a specialty unless you have meaningful experience in it. In 10 years, I see myself practicing as a compassionate, community-focused osteopathic physician who combines evidence-based medicine with a preventive, patient-centered approach. My goal is to build a practice that not only treats illness but also educates patients on sustainable health habits, nutrition, exercise, and emotional balance. I hope to work in an underserved area where I can directly address disparities in care and empower families to take control of their well-being. I also envision mentoring future medical students, much like the mentors who inspired me during my early clinical experiences. I want to stay involved in outreach programs that emphasize access and affordability because true healing extends beyond the clinic walls. I see my career as a continuous cycle of learning, teaching, and giving back, values deeply reflected in LECOM's mission and the kind of physician I aspire to become. Question number 17. What would you do if you were not accepted this cycle? This question gauges your perseverance and maturity. Interviewers want to see that you're resilient, reflective, and committed to improvement, not easily discouraged. Outline a concrete plan to strengthen your candidacy while keeping your motivation strong. If I weren't accepted this cycle, I would use the time to grow both academically and professionally to become an even stronger candidate. I would continue working in a clinical environment to expand my hands-on experience with patient care, while possibly enrolling in advanced anatomy or physiology coursework to reinforce my scientific foundation. I'd also seek additional opportunities to shadow osteopathic physicians to deepen my understanding of OMT and holistic treatment. In parallel, I'd continue volunteering in community health programs because service reminds me why I chose medicine in the first place. Most importantly, I'd take the time to reflect on feedback, reassess my application, and improve areas such as interview performance or personal statement clarity. My passion for medicine is long-term. Setbacks don't discourage me, they motivate me. If anything, another year of experience would make me more prepared and more determined to succeed when I reapply. Question number 18. What experiences shaped your interest in osteopathic medicine? This question is meant to test authenticity. Interviewers want to hear specific stories, not abstract beliefs that connect you to osteopathic philosophy. Focus on personal experiences that reveal your appreciation for holistic and preventive care. My interest in osteopathic medicine began during my work with a family practice physician who happened to be a DO. What stood out wasn't just his medical knowledge, but how he approached patients as complete individuals, asking about stress, sleep, posture, and emotional health before diagnosing. One day I watched him use OMT to relieve a patient's chronic back pain. Instead of relying solely on medication, he explained the body's interconnected systems and how structure affects function. That moment stayed with me because it represented the balance between science and empathy that I admire in medicine. Later, through volunteering at wellness clinics, I saw firsthand how lifestyle, environment, and education influence long-term outcomes. These experiences solidified my desire to practice medicine that empowers patients through education, prevention, and touch, all principles central to the osteopathic philosophy. LECOM's emphasis on these values makes it the ideal place for me to continue growing into that kind of physician. Question number 19. Explain the osteopathic philosophy and its tenets. Interviewers use this to see if you've done your research and truly understand the core of osteopathic medicine. Discuss the 4 tenets clearly, then connect them to your own perspective on patient care. Keep it both academic and personal. The osteopathic philosophy is grounded in the belief that the body is a unit, mind, body, and spirit, and that these components work together to maintain health. The 4 key tenets are: the body is a unit, structure and function are interrelated, the body possesses self-healing mechanisms, and rational treatment is based on understanding these principles. To me, this means that medicine isn't just about managing disease, it's about restoring harmony. I've seen how addressing posture, stress, or diet can improve outcomes just as powerfully as medication. Working alongside DO physicians, I learned that osteopathic medicine values listening as much as diagnosing. It's about recognizing patterns that connect physical symptoms to emotional and environmental factors. This philosophy resonates with me deeply because I believe true healing happens when you treat the person as a whole, not just the ailment. It's the type of care I want to offer throughout my medical career. Question number 20. How have you demonstrated service to your community? LECOM values community engagement, so this question helps them see whether you live by the school's service-oriented mission. Choose 1 or 2 meaningful examples that show genuine impact rather than a list of hours. I've always believed that medicine and service are inseparable. One of the most impactful experiences I've had was organizing monthly blood pressure screenings at a local community center. Many of the participants were uninsured and unaware of their health risks. We not only provided screenings but also educated them on affordable nutrition and exercise options. One woman returned a month later to thank us because she'd started walking daily and reduced her blood pressure significantly. That single encounter reminded me that small interventions can lead to lifelong improvements. Beyond that, I've volunteered at food drives and local health fairs, often focusing on underserved neighborhoods. Each event reinforced my understanding that healthcare extends far beyond prescriptions. It's about presence, education, and consistency. These moments shape my desire to pursue medicine that serves everyone, regardless of background, and they reflect exactly the kind of physician I aim to be at LECOM and beyond. Question number 21. Discuss your most meaningful volunteering experience. Here, interviewers want depth over quantity. Choose one experience that shaped your perspective on empathy or patient care. Describe how it changed your outlook and why it reinforced your passion for medicine. My most meaningful volunteering experience took place at a hospice care center where I spent time talking with patients nearing the end of their lives. Initially, I felt nervous. What could I possibly say to someone in that situation? But I quickly learned that sometimes silence and presence matter more than words. I listened to stories about their families, regrets, and hopes, and it taught me that healing isn't always physical. It can also be emotional and spiritual. One patient told me that just having someone sit and listen eased her anxiety. That moment deeply moved me and shifted my understanding of what compassionate care truly means. It wasn't about curing, it was about comforting. Volunteering there strengthened my emotional resilience and empathy, 2 traits I know are essential in medicine. It reaffirmed my commitment to osteopathic values, where treating the whole person means honoring their humanity at every stage of life. Question number 22. What have you learned from shadowing and patient exposure? This question reveals how well you've reflected on your experiences rather than just accumulating hours. Focus on the insights you gained about doctor-patient relationships, teamwork, and professionalism. Shadowing several physicians gave me a first-hand look at the nuances of patient care beyond textbooks and theory. I learned that medicine requires patience, humility, and constant communication. One DO I shadowed often said, "Treat the person, not the chart," and I watched how he listened attentively before touching a stethoscope. He asked questions about family, sleep, and stress, things that often revealed the root of a problem. I also observed how teamwork drives successful outcomes. Nurses, assistants, and physicians worked like a well-coordinated system built on respect. Watching this dynamic taught me that good medicine is a collaboration, not a solo act. These experiences solidified my commitment to osteopathic medicine because they embodied the philosophy I believe in, that every patient is more than a collection of symptoms. They are a story that deserves time, understanding, and trust. Question number 23. How do you work on a team and support peers? Teamwork is essential in medicine, so interviewers want to see examples of communication, respect, and shared responsibility. Highlight collaboration and adaptability under pressure. I thrive in team settings because I believe every member brings a unique strength to the table. During my time in a clinical office, teamwork was essential for keeping patient flow smooth and efficient. When our lab technician unexpectedly fell ill, I volunteered to assist with specimen prep and documentation so appointments could continue without delay. Everyone pitched in and communicated constantly to make sure nothing fell through the cracks. That experience reinforced my belief that leadership isn't just about giving direction, it's about showing up for your team when they need you most. I've also learned to appreciate diverse viewpoints and recognize when to ask for help, which improves both morale and outcomes. In medicine, no one succeeds alone, and I'm committed to fostering an environment of mutual support, respect, and open communication in any healthcare setting. Question number 24. How would you handle a classmate acting unprofessionally? LECOM emphasizes professionalism and integrity, so this question tests your ethical reasoning. Show balance, addressing the issue responsibly without hostility or avoidance. Reflect accountability and empathy. If I observed a classmate behaving unprofessionally, such as disrespecting a patient, faculty member, or peer, I would approach the situation calmly and privately first. I'd want to understand if there were external stressors influencing their behavior before making assumptions. If the behavior persisted or affected others, I would escalate it through the proper academic or administrative channels. In medicine, professionalism is not optional. It directly affects trust and safety. During my clinical work, I've seen how one careless act can impact the entire team's credibility. That's why I believe addressing issues early and respectfully protects everyone involved. I would aim to handle it with empathy but also accountability, maintaining the integrity of our profession and the standards expected at LECOM. It's about balancing compassion with responsibility, a principle that mirrors how physicians must address errors or misconduct in real-world practice. Question number 25. How would you respond if you observed academic dishonesty? This question tests moral courage and ethical judgment. LECOM highly values integrity, so your answer should demonstrate honesty, fairness, and an understanding of professional responsibility. If I witnessed academic dishonesty, my first priority would be to preserve the integrity of the program and the trust among peers. I would address the situation thoughtfully, first confirming what I saw and considering whether to approach the individual privately to encourage them to take responsibility. If they refused or the situation compromised fairness, I would report it through the proper academic channels. I understand that integrity in medicine begins long before entering practice. It starts in training. A physician's credibility rests on trust, and cheating undermines that foundation. During my clinical experience, accuracy and honesty were non-negotiable. One mistake could harm a patient. That same standard applies in academics. While it's uncomfortable to report misconduct, protecting the ethical standards of the profession is far more important. My response would always prioritize honesty, fairness, and accountability, values that define both medical education and patient care. Before we continue, I just want to take a moment to thank you for watching this video. You can download a copy of these interview questions and answers in PDF format by clicking on the link below and supporting my channel by making a minimum donation of $3. Your support allows me to keep creating valuable content to help you pass your interview and land your dream job. Thanks for your support and appreciation. Question number 26. How would you handle a patient confidentiality dilemma? This question evaluates your understanding of ethics, HIPAA, and judgment under pressure. LECOM wants to see that you prioritize patient trust and legal responsibility while communicating professionally. Emphasize discretion, proper reporting, and awareness of institutional protocols. If I encountered a situation where patient confidentiality was at risk, I would handle it with immediate care and professionalism. For instance, if a coworker unintentionally discussed a patient's condition in a public space, I would gently remind them that such discussions should occur in private areas. Protecting patient privacy is fundamental to maintaining trust and upholding ethical standards. During my clinical experience, I've seen how easily confidentiality can be compromised without intention. Something as small as leaving charts visible or sharing unnecessary details. I always make it a priority to safeguard patient data by following HIPAA guidelines strictly. If the breach were significant or intentional, I would report it through the proper compliance channels to ensure accountability and correction. My goal would never be to shame anyone, but to preserve the trust that patients place in healthcare professionals. I believe confidentiality isn't just a legal obligation, it's a cornerstone of respect, empathy, and professionalism in medicine. Question number 27. Describe an ethical dilemma in healthcare and your approach. This question tests your moral reasoning and integrity. Choose a real or realistic situation, describe the conflict briefly, and focus on your thought process, how you balanced competing values like honesty, autonomy, or patient welfare. An ethical dilemma I once witnessed involved a patient who refused a necessary diagnostic test due to financial concerns. The physician wanted to insist, but the patient was visibly distressed about the cost. Watching that interaction reminded me how medicine often intersects with difficult socioeconomic realities. Afterward, I helped the nurse provide information about low-cost clinics and financial assistance programs. This allowed the patient to feel respected and supported rather than pressured. It taught me that ethics in medicine isn't just about right or wrong, it's about compassionately navigating gray areas. I learned the importance of preserving patient autonomy while ensuring they have the information and resources to make informed decisions. In situations like these, empathy and education can bridge the gap between medical necessity and personal circumstances. This experience reinforced why I value the osteopathic philosophy. It recognizes the full context of the patient's life, not just their diagnosis. Question number 28. What does professionalism mean to you? LECOM emphasizes professionalism as one of its core values. This question assesses your understanding of responsibility, integrity, and respect in both academic and clinical settings. Provide examples that show your consistency and reliability. To me, professionalism means showing respect, integrity, and accountability in every interaction, whether with patients, colleagues, or peers. It's about maintaining composure under pressure, honoring commitments, and treating everyone with empathy and fairness. During my time in healthcare, professionalism wasn't just about appearance or punctuality, it was about earning trust. For example, when I worked in a clinic, patients would sometimes express frustration due to long wait times. I learned to respond calmly, explain the situation transparently, and reassure them that their care mattered. That approach diffused tension and strengthened rapport. I also see professionalism as a mindset of humility, being open to feedback, learning from mistakes, and holding oneself to the highest ethical standards. In medicine, professionalism builds the foundation for safety and collaboration. I plan to carry that same standard to LECOM, where I can contribute to a culture of respect, responsibility, and service. Question number 29. What does success mean to you? This question helps interviewers understand your motivation and mindset. Avoid equating success solely with status or income. Instead, emphasize growth, impact, and purpose, values aligned with medicine's service-driven nature. I define success as the ability to make a meaningful, lasting difference in the lives of others while staying true to my values. In medicine, success isn't measured by titles or recognition. It's in the quiet victories, helping a patient manage a chronic condition, easing someone's anxiety, or empowering them to make healthier choices. I've experienced this firsthand while assisting in primary care, where success often came in moments of connection rather than dramatic outcomes. It also means continuous learning, staying curious, reflective, and open to new knowledge. Success to me also involves balance, maintaining compassion without burnout, ambition without arrogance. I believe real achievement lies in growth that benefits both the individual and the community. As a future physician, I hope to measure success not by how many patients I treat, but by how many feel seen, understood, and genuinely cared for. Question number 30. What healthcare issue in America concerns you most? This question tests your awareness of current issues and your ability to think critically about the healthcare system. Choose an issue you understand well and connect it to your personal experiences or career goals. The issue that concerns me most in American healthcare is the lack of equitable access to preventive and primary care. Working in outpatient clinics, I've seen how many patients only seek help once conditions become severe, often because they couldn't afford earlier intervention. This delay not only worsens outcomes, but increases healthcare costs system-wide. Preventive care should be the cornerstone of our system, yet it's often underemphasized due to socioeconomic barriers. I believe we need stronger community health education, expanded access to affordable screenings, and incentives for providers to focus on prevention. The osteopathic approach aligns perfectly with this philosophy, as it emphasizes treating the whole person and preventing illness before it starts. Addressing this issue is one of the reasons I'm passionate about primary care and community health. As a future physician, I want to be part of the movement that redefines healthcare from reactive treatment to proactive wellness. Question number 31. How would you address a major issue in medicine you have observed? This question assesses your understanding of current healthcare challenges and your ability to think critically about solutions. Choose an issue you've personally witnessed, like access to care, health literacy, or over-reliance on medication, and discuss how you would address it as a future physician. Avoid political opinions and focus on patient-centered, constructive ideas. One issue I've observed repeatedly is the lack of health literacy among patients. Many individuals I've encountered in clinical practice struggle to understand their conditions or treatment plans, which leads to poor adherence and preventable complications. I believe this stems not from disinterest, but from communication gaps between providers and patients. As a future physician, I plan to address this by using clear, empathetic language and verifying patient understanding at every visit. During my time assisting with patient education sessions, I saw how visual aids and relatable analogies transformed comprehension. One diabetic patient told me, "No one ever explained it like that before." That moment showed me how powerful education can be. I also believe community outreach and preventive workshops are key, meeting people where they are, not just in exam rooms. LECOM's emphasis on community-based learning strongly aligns with this belief, and I hope to use my medical education to bridge these gaps on a larger scale. Question number 32. How do medical schools help preserve empathy in trainees? Interviewers want to see if you're aware of the emotional demands of medical training and have ideas for maintaining compassion over time. Reflect on how burnout affects empathy and suggest practical solutions like mentorship, mindfulness, or reflection programs. I think empathy can fade when students become overwhelmed by stress, competition, or academic pressure. Medical schools play a critical role in protecting that empathy by creating environments that encourage balance, reflection, and human connection. One approach could be integrating reflective journaling or discussion groups into the curriculum, spaces where students can share experiences and process their emotional responses. Mentorship is also vital. During my clinical work, I noticed that when mentors modeled vulnerability and compassion, students felt more permission to care authentically. I also believe incorporating patient narratives and humanities courses reminds us of the human side of medicine beyond test scores and anatomy labs. Programs that emphasize mental health support and wellness activities can also prevent burnout before it begins. By nurturing these practices, schools like LECOM ensure that their graduates don't just know medicine, they embody it with empathy, humility, and heart. Question number 33. How would you communicate with patients from diverse backgrounds? This question evaluates cultural competence and communication skills. Show respect for diversity by emphasizing listening, curiosity, and adaptability. Provide an example where cultural awareness improved patient care or understanding. Communicating with patients from diverse backgrounds requires humility, curiosity, and respect. I've learned that the first step is always to listen, truly listen to how a patient describes their experiences, beliefs, or fears. At my clinic, I once worked with a patient whose cultural beliefs influenced her approach to medication adherence. Instead of correcting her immediately, I asked open-ended questions to understand her reasoning. This built trust and opened a door to meaningful discussion, where we found a balanced solution that honored her beliefs while ensuring safety. I also make an effort to avoid medical jargon, use interpreters when needed, and learn about cultural norms that may affect care preferences. Each encounter reminds me that healing is relational. It depends on trust as much as on treatment. As a future physician, I plan to continue developing cultural humility because respecting a patient's worldview is one of the most powerful ways to promote both dignity and compliance. Question number 34. How would you contribute to community health at LECOM? LECOM highly values service-oriented students. Use this question to show initiative and connection to their mission of promoting health education and preventive care. Mention how you'd participate in or start community-based projects. I would contribute to community health at LECOM by combining my experience in public outreach with the school's focus on preventive medicine. I've organized several health screening events in underserved neighborhoods and have seen how simple education about diet, exercise, and early testing can change lives. At LECOM, I would love to collaborate with classmates to expand similar outreach initiatives, perhaps hosting student-led wellness fairs or chronic disease workshops. I'm particularly interested in working with children and families to promote long-term healthy habits. I believe small, consistent education in local communities has a generational impact. I'd also be eager to assist in LECOM's existing public health projects, helping bridge medical students with local organizations to reach more people. For me, community health isn't a side project, it's a lifelong mission. Joining a school that prioritizes service and population wellness feels like the perfect way to amplify the work I've already begun. Question number 35. How would you contribute to making America healthy again? This question reflects one of LECOM's signature themes from its mission statement and essay prompts. The best answers focus on prevention, education, access, and advocacy, not politics. Show optimism and leadership potential. I believe making America healthy again begins with empowering individuals through education, prevention, and accessibility. Working in primary care, I've seen how many chronic illnesses stem from small habits, poor nutrition, inactivity, unmanaged stress that compound over time. My goal as a physician is to focus on early intervention rather than reaction. I'd love to be part of community programs that teach families how to manage their health before illness develops, especially in underserved populations where resources are limited. I also believe that promoting empathy and trust in healthcare can rebuild patient confidence, encouraging them to seek care earlier. On a broader scale, I hope to advocate for initiatives that integrate nutrition, exercise, and mental wellness into primary care settings. As a future LECOM graduate, I'd carry forward the school's mission to heal communities holistically, mind, body, and spirit, helping create a healthier, more informed America, one patient at a time. Question number 36. What attributes would you bring to LECOM? This allows you to highlight personal traits that match LECOM's values: professionalism, discipline, empathy, and teamwork. Choose a few qualities and support them with real examples. I would bring to LECOM a strong sense of discipline, compassion, and collaboration. Years of working in healthcare have taught me to manage time effectively, handle high-stress situations calmly, and communicate clearly with both patients and colleagues. My compassion drives me to connect with people beyond their symptoms, to see who they are, what they fear, and what motivates them. I also value teamwork deeply. I believe great medicine is always a collective effort. My clinical supervisors often commended my reliability and calm presence during chaotic moments, traits that translate well to medical school's demanding environment. Lastly, I bring an unwavering curiosity and eagerness to learn, not only from instructors but from peers and patients alike. I believe my character aligns with LECOM's mission of forming physicians who serve with integrity, respect, and lifelong commitment to both learning and humanity. Question number 37. What makes you a stronger candidate than others? This question assesses confidence without arrogance. Focus on unique qualities, life experiences, or perspectives that differentiate you. Show self-awareness and humility while emphasizing commitment and readiness. I believe what makes me a strong candidate is the depth of real-world healthcare experience and the emotional intelligence I've developed from it. I've worked in fast-paced clinics where empathy and adaptability mattered as much as medical knowledge. These environments taught me to remain calm under pressure, listen deeply, and see the patient behind the chart. I've also made service a consistent part of my journey, volunteering in community health outreach and working with underserved populations. Beyond academics, I bring resilience. Overcoming obstacles has shaped my work ethic and humility. I'm not just pursuing medicine as a career, but as a calling that connects science with service. What sets me apart is that I understand both the technical and human sides of healthcare. My goal isn't to compete with others, it's to contribute meaningfully to LECOM's mission and become a physician who heals with both knowledge and compassion. Question number 38. What is your greatest accomplishment and why does it matter to you so much? Here, LECOM wants to see reflection and purpose. Choose an accomplishment that demonstrates perseverance, leadership, or service. Something that shaped your values or perspective on medicine. My greatest accomplishment was leading a team to organize a community hypertension awareness program that reached over 400 residents. We collaborated with local pharmacies, dietitians, and volunteers to provide screenings and education about blood pressure management. Initially, turnout was slow, but through persistent outreach, we earned the community's trust. Seeing people return with improved readings and lifestyle changes months later was incredibly rewarding. That project taught me how leadership in medicine isn't just about authority, it's about persistence, collaboration, and belief in impact even when progress is slow. It also deepened my passion for preventive healthcare, showing me that empowering people with knowledge is one of the most powerful forms of treatment. This experience reaffirmed that my purpose in medicine extends beyond clinics. It's about creating sustainable health change in communities that need it most. Question number 39. How do you manage time and competing priorities? Interviewers ask this to ensure you can handle medical school's demands. Show that you're organized, disciplined, and adaptable. Use specific strategies or examples from your academic or professional life. I manage time through careful organization and a structured but flexible mindset. Working in healthcare, I often juggled multiple responsibilities: charting, assisting physicians, managing calls, and coordinating patient follow-ups. I learned early on that effective time management isn't about doing everything fast, it's about doing everything purposefully. I start each day by prioritizing tasks using a simple system: urgent, important, and deferrable. This approach allows me to focus on what truly impacts patient outcomes or team performance. I also block time for study, reflection, and self-care, understanding that balance fuels productivity. During particularly demanding weeks, I use digital calendars and task tracking tools to stay aligned with goals. These habits have helped me maintain academic excellence while working part-time and volunteering. I know medical school will be intense, but I've built the resilience, focus, and structure needed to thrive in that environment without losing sight of what matters most: quality and compassion. Question number 40. How do you handle feedback and use it to improve? This question gauges humility, growth mindset, and professionalism. Use a real-life example that shows you welcome constructive criticism and act on it effectively. I see feedback as one of the most valuable tools for personal and professional growth. Early in my career, a supervising nurse mentioned that I sometimes rush through explanations with patients due to time constraints. Rather than taking it personally, I saw it as an opportunity to improve my communication. I began consciously slowing down, confirming patient understanding, and practicing active listening techniques. The difference was remarkable. Patients became more engaged and compliant, and my rapport with them deepened. Since then, I've developed a routine of asking colleagues and mentors for input after challenging days. Feedback helps me see blind spots and refine both my technical and interpersonal skills. I also make sure to reflect on it privately, translating advice into measurable actions. I believe good physicians are lifelong learners, and that means continuously seeking ways to be better for patients, for teams, and for themselves. Question number 41. What books, research, or topics in medicine have inspired you recently? This question allows interviewers to see your intellectual curiosity and engagement with medicine beyond the classroom. Choose something relevant to osteopathic philosophy or patient-centered care. Explain not just what you read or studied, but why it resonated with you and how it influenced your thinking. One topic that has deeply inspired me lately is the emerging research on the gut-brain axis and how it connects physical and emotional health. Reading medical journals on this subject revealed how lifestyle, diet, and mental wellness are interwoven, something osteopathic medicine has always emphasized. I was fascinated by how adjusting something as simple as nutrition can improve mental health and reduce inflammation, showing that the body truly functions as an integrated unit. It reminded me of the osteopathic principle that structure and function are interrelated, and that healing often begins with understanding those connections. I also recently read Being Mortal by Atul Gawande, which profoundly changed how I think about compassion in medicine. It reinforced that medicine isn't only about prolonging life, it's about improving its quality. Both the research and literature have shaped how I want to practice, with curiosity, empathy, and respect for the body's intricate design and the human stories behind every patient. Question number 42. How would you approach primary care needs in underserved areas? This question evaluates your understanding of healthcare disparities and your motivation to serve vulnerable populations. Focus on accessibility, education, and prevention. Highlight your compassion and practical ideas for creating community impact. Approaching primary care in underserved areas requires creativity, cultural sensitivity, and genuine community engagement. I've worked with patients who delayed care simply because transportation, cost, or fear of judgment created barriers. I believe addressing these challenges starts with building trust and meeting people where they are. As a future physician, I'd prioritize outreach programs that bring preventive services directly into communities through mobile clinics, wellness workshops, and partnerships with local organizations. Education is equally vital. Teaching families how to manage chronic conditions and recognize early warning signs can prevent hospitalizations. During my time volunteering in low-income neighborhoods, I learned that empathy and consistency matter more than fancy facilities. People respond when they feel respected and heard. I'd also advocate for integrating telemedicine and affordable care models to increase access. At LECOM, I hope to continue developing these approaches so I can contribute meaningfully to improving primary care equity across underserved regions. Question number 43. How would you explain osteopathic manipulative treatment to a skeptical patient? Here, interviewers are testing your communication skills and ability to build trust. Keep your explanation simple, evidence-based, and empathetic. Show that you respect skepticism and can educate without sounding defensive. If a patient seems skeptical about OMT, I would first acknowledge their concerns with respect. I'd explain that osteopathic manipulative treatment is a hands-on technique used to improve the body's alignment, mobility, and overall function, helping it heal more efficiently. I'd emphasize that it's not an alternative to medicine, but a complementary approach grounded in anatomy and physiology. For example, I might say, just like physical therapy or massage can help muscles recover, OMT supports the body's natural balance and circulation to relieve pain or tension. I would also discuss how research supports its benefits for musculoskeletal issues, chronic pain, and even migraines. Sharing patient success stories from my clinical experience often helps people relate. Above all, I'd reassure them that treatment decisions are collaborative. They'll always have a choice. Building trust through transparency and empathy is essential. And I've found that once patients feel heard, they're more open to understanding the osteopathic approach. Question number 44. How would you respond if a patient requested non-evidence-based treatment. This question evaluates ethics, professionalism, and communication. Show that you respect patient autonomy, but also maintain scientific integrity. Focus on education and open discussion rather than judgment. If a patient requested a non-evidence-based treatment, I would first listen carefully to understand their motivation, whether it's cultural, emotional, or fear-driven. I'd acknowledge their perspective and then calmly explain what current medical evidence says about the treatment's safety and efficacy. My goal would be to educate, not dismiss. I'd say something like, "I understand why this interests you. Many people are looking for natural options. Here's what studies show, and here's what we know works best for your condition." By providing clear information and discussing potential risks, patients can make informed decisions while feeling respected. I've found that when people feel heard, they're more likely to trust medical advice. If appropriate, I'd suggest safe, integrative alternatives that align with both their preferences and science. Medicine is about partnership, not authority. And I believe honest, respectful dialogue empowers patients to choose evidence-based care that still honors their individuality. And finally, here's the last LECOM interview question. Question number 45. What do you hope to gain from LECOM's curriculum and pathways? Interviewers want to see that you've researched LECOM's unique learning models, PBL, DSP, LDP, and understand how they match your learning style. Highlight self-discipline, collaboration, and alignment with their mission. I'm particularly excited about LECOM's flexible learning pathways, especially the problem-based learning (PBL) program. I learn best through collaboration and active problem solving, and PBL's small group approach mirrors how physicians work in real clinical settings, analyzing information, developing differential diagnoses, and applying knowledge to patient cases. I also appreciate that LECOM emphasizes professionalism and structure, helping students develop both academic excellence and personal discipline. The ability to tailor my learning style while maintaining accountability is something I value deeply. I'm drawn to the integration of ethics, communication, and preventive care woven throughout the curriculum. It reflects a truly holistic training model. Beyond academics, I hope to gain mentorship from faculty who are deeply invested in shaping empathetic, well-rounded physicians. I believe LECOM will not only challenge me intellectually, but also refine my sense of purpose to serve communities with competence, compassion, and integrity. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.